Welcome to our Healthcare IT Services Quarterly Performance Review webcast, highlighting the results from our recent Healthcare IT Services benchmark. My name is Allison Crawford, and I will be your host for today's session. Tech Business Research's focus is to business research to accelerate our clients' success, and this is a part of these ongoing efforts to find ways to support you and your business, helping you get the most out of your research investment. Highlight during the session, Health IT Services is one of the areas attracting interest and real investment dollars, representing an important opportunity for vendors in the IT space to generate growth. This is one example of the topical research around which we will connect our readers with our analysts to relate the results and insights to cutting-edge research. Our goal is consistent, to provide insight into the market and competitive strategies that translates into competitive advantage for our clients. Analyst Joe Walent and Senior Analyst and Practice Manager John Caucis will delve into the trends driving the results featured in this quarter's benchmark. Follow many of these trends and how they will affect you. Before over to Joe and John, there are a few logistics I'd like to cover. We'll be recording this session and posting it to our YouTube site, TBR channel. We encourage you to visit our channel to watch this presentation or any of the others we've posted. To hear your opinions and thoughts on the materials we're presenting. Please questions or comments to the Q&A or chat function. Joe will address them at the end of the presentation. Or if you'd like to set up a client inquiry for more detailed discussion, please direct it to Joe and John at the end of the webinar with a CC to your account executive to set up that discussion. We'll send the slides to everyone registered for today's webcast within 24 hours of the conclusion of the webinar. You can find slides as well as our thought leadership pieces, other webinars, and commentaries on SlideShare at www.slideshare.net/TBR_market_insight. Our in the IT services market for a total of 16 years. John is analyzing the market for the past 10 years and is TR's resident expert in the government practice. John has been critical in the planning of his clients' black hat strategies. Joe is the HITS lead analyst and has been a leader in the program since its initial coverage of CSC. His insight into the performance of the HITS vendors is unparalleled in the industry, and his guidance has assisted countless clients with their strategic planning. And with that, let me hand this over to Joe and to John. John?
And thanks, everyone, for joining us today. My name is John Caucis, Analyst and Practice Manager for the Public Sector and Healthcare IT Services practices here at Technology Business Research. Today, I'll provide the audience with some background information regarding our research approach and methodology. This is a space. We follow on an ongoing basis 18 vendors. In addition to 18 vendors, we publish 5 healthcare IT services company reports on the healthcare IT services businesses of Accenture, Computer Corporation Services, HP Services, and IBM Global Services. Finally, we did qualitative analyses of these 5 care-centric firms in a quarterly benchmark report, companies that we do not follow on a syndicated basis. Healthcare IT services contractors, TBR included them to provide insight into the health IT services market. That's the field that we have carved out a representative cross-section of the overall healthcare IT services arena. And with that discussion, over to Joe Walent, our lead for the healthcare IT services practice at Technology Business Research.
Thank you, and thank you once again to everyone that joined us today. Let's dive in. So the main themes in the 20 healthcare IT services benchmark were summarized as follows. The state of the market in the quarter of 2012. The key is that were discussed by an increasing number of healthcare IT service vendors in 2012. And finally, the direction of health IT services space and anticipatory actions taken by vendors to position for those trends. Health services continues to operate as an area of strength for vendors. It's apparent across the board with all vendors indicating strong revenues, and they had other revenues decline in the same period. Improved outcomes are a universal theme for clients in need of IT services, providers, payers, federal, state, and local governments, and life sciences firms. This is across the regions that we look at, the Europe, Middle East, and Africa, and Pacific. Take a moment and orient you to this chart. The axis indicates the 12 revenue growth velocity. The y-axis indicates the 12 trailing month operations for companies. The size of each sphere is determined by the 12 trailing month revenue amount of the healthcare IT services vendor that in each case. New experienced positive growth and favorable margin performance, indicating the general trend in the covered companies' TTM growth rate in a public service provider healthcare IT services benchmark was 2.2% in the second quarter, with an entrance to the market with 66% TTM healthcare growth rate, as ended on a small base. This also in growth velocity were dynamics and SAIC that have been bolstered by recent healthcare IT service acquisition activity. Companies focusing their services primarily on the implementation of their own in-house software, as is the case of Cerner and CI, fair terms of operating margin. Indo-centric companies that had effectively leveraged a more advantageous cost structure in application development and management services. TBR believes the wait-and-see approach from clients overall kept rates from accelerating and kept them either sustained or slightly decelerating in the second quarter, pending the decision by the Supreme Court on the Affordable Care Act at the second quarter of 2012. This was founded and will continue to be affected by the uncertainty around the future direction of federal health care policies due to the current election cycle. On the previous slide, most healthcare IT service providers made revenue growth during the second quarter of 2012. We have three detail here. By its federal revenue streams outside its traditional courses, General Dynamics' acquisition of Tangent in the year-ago quarter served to generate strong revenue growth in the health IT services space. Without the impact of the acquisition, General Dynamics has recorded health IT services revenue contraction, and with the impact of the Walent acquisition rolling off, General Dynamics will slip back into the pack. The healthcare IT services served as the main driver for Accenture during 2012. Growth rate, the company continues to expand its addressable market, pushing further into Europe and to Asia Pacific. Calling out the one or lone draggard in the previous bubble chart, negotiation of the CSC flagship deal with the National Health Services in the UK continued to weigh on the firm's health IT service metrics, capturing significant portions of the original deal. CSC will regain a solid position with health service years as the impact of the deal renegotiation out over the second half of 2012, and the company will be amongst lead in positions of the first half of 2013. aspect of it. Forces influenced the healthcare IT services were in greater demand as defined by trends in the industry in the second quarter of 2012. Regulatory pressures and increasing levels of oversight and mandated change, coordinate care to realize improved outcomes, and the need to mobile solution sets to improve patient accessibility across all segments, including the patient. As the underlying drivers for Revit vendors securing more business in the expanding healthcare IT services market. They were on all the minds of various segments, but especially the provider segment. Integration of how healthcare information is recorded to move all forward in both the U.S. and internationally, especially ICD-10, but also with incentives for ER implementation. Outcome-based compensation away from volume-based compensation placed greater for coordinated care delivery. These increased need for mobile solutions in response to the global shifts to handheld information access. The phones and tablets, healthcare professionals and patients will aid or further this in many respects, but there's additional challenges, including security, information, boards as far as remote monitoring and use of telemedicine. Sought to provide specific solutions as outlined above. We'll drive a bit deeper in the next slide. It introduced its health benefit exchange solution to help states establish insurance exchange required for Affordable Care Act, where they'll to have the ability to take on new business and open registration by October of next year. We believe it will continue to build out its portfolio to gain government compliance-related deals in the U.S. healthcare market. Translating existing unformatted data and ICD-9 codes to ICD-10 codes, which is labor-intensive, will be an avenue that Emphasis pursues. We also see participants such as HCLT and Cognizant follow as well. Where my work, we believe, the same kind of Y2K coding needs. Early tie-in with the Federal Health Architecture Office positioned the company to contribute insight into how best to structure the overall effort and digitize health data at the federal level. As informational availability and exchange, TG has a front seat and experience and will be well positioned to advise data entities that will be tie-in with nationwide health network. The season given with the NHS to innovate healthcare delivery tools early on in the cycle. The patient pocket solution enables healthcare professionals in the field to have secure mobile access to patient records and make real-time modifications and updates. This is to the fore with the tie-in of CS with Sprint for cloud service delivery, which includes a wireless and mobility component. To be able to more adequately roll out the patient in your pocket solution in the U.S. Further, SoftBank's purchase of Sprint will expand the addressable market to include Asia Pacific. Take a look at the outlook for the HITS market and in the steps some providers took in the second quarter of 2012 to increase the velocity and coverage of the market. On this plotted the average HITS benchmark revenue growth rate against the broader IT services rate, IT service vendor benchmark report. While there'll be continued deceleration for healthcare IT services revenue growth, it will remain in the double digits. The outlook for the broader market is less rosy, with more dissolution. The demand for electronic health records and the associated health information exchanges will remain at the center of demand in the health IT services marketplace. We're looking to the digitization of healthcare data to drive the low costs from repetitive tests and excessive the flexibility and security in private cloud infrastructure will be employed by large and small entities in the provider space as well. Waiters will implement allowing the to focus on managing business flows in care delivery. Essays of Max IT. To the changing nature of the public sector IT service market at the federal level, we spent $437 million to acquire capabilities around EHR and is now one of the leading providers in the space. On its acquired state medication information system business relationships when it acquired ACS and basis. The team has win with choice and positioned the company to deliver health insurance exchange solutions. Health insurance solutions is a facet of the CARE Act, as we previously discussed, and we know it was by election. How turnout in the election remains an open question. Finally, investments with proven solution for clinical imaging has expanded in its global reach and with partnership with AGFA. Will help also introduce Dell Cloud solutions to the marketplace. Of the health IT services space, we're looking at care IT services and expanding and honing in on the recurring themes laid above. Healthcare in IT services and the trends, especially with regards to mobility. Open it to questions.
John, we had a few questions come as we suggested. If you have questions on anything that Joe has just presented, please send them to the CARE chat function right now. The question we had come in is, in your opinion, what is the aspect of healthcare IT services vendors will need to focus on going forward?
I think is going to be the largest piece that care IT service vendors will need to be aware of across all segments that we track: providers, payer, federal, state, and local agencies. In delivering those tools that better enable the coordination of care to ensure an accurate and secure transfer of information, this is definitely an area where they'll have to continue to invest and expand. Government and commercial players are already driving towards operability and how that is going to work. So that's going to further add the need to expand in healthcare IT services areas. We just outcome-based and interoperability of information. And also I think the increasing aspect of or expansion of the Asia-Pacific market will have an investment that we'll see more vendors pursuing going forward.
The next question that's come in is, how will the conclusion of the 2012 election cycle in healthcare IT services in 4Q12?
Well, the first thing that immediately jumps to mind is the need to establish those healthcare insurance exchanges. The deadline for having your plan submitted is November 16th, and only 14 have submitted the plans thus far. I believe that many states have been for the decision of who will be the nation's president for the next 4 years, and as far as, whether pursue or actually finding a way to delay those things. So I think the immediate response. I think, should I win the election, there's going to be a rush of states picking those package solutions for health insurance exchanges. In the other case, there's going to be petitions to delay and Romney win the election, see how they're going to move about either funding or disabling the Affordable Care Act as was promised in the election.
Okay. Question come in. Could you talk a bit about the mix between application versus infrastructure investment outlook? It seems like there's a lot of application desire on an infrastructure and able to support it, especially when it comes to the exchanges.
I think what the standpoint, we're seeing more customers. There's definitely, but on a state-by-state basis, I believe we're talking about health information exchanges and also health insurance. Cloud is going to be becoming a greater piece, and that's leveraged in the end delivery of these solutions at the state level. With that, I think that from the between development and then actual infrastructure that's being pulled together, the move and split. But I'd say that the move right now is definitely primarily towards the establishment of workable solutions, and that would be on the development side.
We had it came in. How are healthcare IT service vendors adding analytical capabilities?
Is that, with drive towards greater data availability, the need for analytical solutions is mounting, and more providers are looking to leverage the availability of data and come up with solutions. Going to be, through the fastest possible, which is acquisition. Example that we saw was IBM's of Vivesimo in Q12, and is bringing additional big data analytic capability in-house. Now, that wasn't necessarily a pure healthcare IT services play, but we feel that the expertise that's brought in will be able to be leveraged across the health IT services at IBM and then brought to bear. Also, earlier this week, Deloitte Consulting announced the purchase of Recombinant Data, a healthcare data warehousing and analytics firm. So definitely where we're seeing, and we expect more action activity along those lines, whether it be capability can then be molded to healthcare IT services or analytical capability as well.
Yes, John Caucis. I'd also like to comment that we're companies outside of the sphere of our coverage of the health IT services that are looking to do a lot of the same things in terms of acquisitions. Companies like Booz Allen and CACI, we believe that they may be candidates to be acquirers. Companies looking to acquire capabilities of the healthcare IT services space. We believe that there is going to be an uptick in the leverage of acquisitions to build capabilities both on the applications as well as on the infrastructure side.
Great. Looks like we don't have any further questions that have come in, but we will keep it open for a few minutes. I want to thank John and Joe and everyone for your questions. There is one question we'll be doing some follow-up work and getting back to the list. Really enjoyed our interaction today, and we we look forward to speaking with you again next quarter. Before we sign off, we'd like to encourage you to follow John and TBR on Twitter. I've provided the handles here for your viewing pleasure. And to remind you to check out SlideShare and YouTube for both this presentation as well as others. As you're leaving the webinar, we are running a survey to find out about the content of the presentation, the presenters. So please do give us your feedback. We'll leave the chat function open for another few minutes in case there's any last-minute questions or follow-up conversations you'd like to have. And we look forward to speaking with you all next quarter. Thanks, everyone. Have a great afternoon.